Hey there, guys. Let's go ahead and discuss Chapter 9, Organization of Care. Okay, so first we're going to discuss prevention and some of the services that are associated with it. Prevention of disease and maintenance of general good health care are the focus of health promotion and preventive services. Services associated with prevention may focus on the health of an individual or the health of a population. Clinical prevention services are categorized as primary, secondary, and tertiary. I can never say that word right. Preventative focuses on preventing or reducing the likelihood of the disease occurring in the future. Services include things like immunizations, weight loss program, prenatal care, and well baby care. Secondary prevention services focus on early detection. So you want to get it early, detect it early, and treat it as early as possible in order to care or control its effects. Services include routine exams and testing, so things like pap smears, colonoscopies, and mammograms. And then lastly, we have tertiary prevention services, and they focus on individuals who already have symptoms of a particular disease in order to prevent damage from the disease, to slow it down its progression, to prevent complications, and restore good health. Services include providing diabetic patients with education on wound care and infection control at hospitals. Next, we are going to discuss acute care and some types of care that fall underneath that. Acute care consists of short-term care. It can be intense, it can provide diagnosis and treatment of a disease, illness, or injury. Here I've also attached about 2.5-minute YouTube video on the difference between emergency care versus urgent care. I found this video to be pretty helpful because although I've used both emergency care and urgent care, I didn't really know what the difference was. In my mind, I could just go to either one of them if I couldn't get a doctor's appointment for something that I needed help with right at that moment. Pre-hospital care provides medical services within the community. Tertiary care involves hospitalization for specialty care that requires highly specialized equipment. Quaternary care is an extension of tertiary care. It provides complex medical and surgical care for highly specialized and unusual cases. Subacute inpatient care is needed by an inpatient immediately after or instead of hospitalization for acute illness, injury, or exacerbation of a disease process. Other forms of care are rehabilitative care, long-term care, and end-of-life care. Rehabilitative care services aim to restore a person to their original state, while long-term care provides assistance with activities of daily life such as bathing, eating, and instrumental activities of daily living such as housework and taking medications. End-of-life care is provided in the final hours or days of an individual's life. Palliative care can be provided to assist with discomfort, symptoms, and stress of serious illness. Here we are going to discuss some of the different types of healthcare delivery organizations. Healthcare delivery organizations exist to deliver healthcare services. These organizations include places like hospitals, physician organizations, ambulatory services, long-term care organization, and rehabilitative organizations. There are more than 10,000 different types of hospitals that range from community hospitals that are accessible by the general public to rehabilitative hospitals that specialize in providing therapeutic interactions to keep patients regaining functional ability. Physician organizations consist of solo practices where a physician practice is operated by one physician. Single specialty group practices are most common and have two or more physicians with the same type of medical specialty. And lastly, multi-specialty group practices consist of two or more physicians who practice different medical specialties. Ambulatory service centers provide surgical services for procedures that are done on an outpatient basis. These type of procedures consist of things like wart removal or abscess drainage. You don't need to stay in the hospital for those particular things. You can get the wart removed and go home that same day. Long-term care organizations operate facilities for people who are not able to manage independently in the community. And rehabilitative organizations can be inpatient or outpatient. They include inpatient rehab hospitals, rehabilitative units in acute care hospitals, skilled nursing facilities, and outpatient rehab centers. Here we are going to discuss the triple aim. The idea behind the triple aim is that to improve the delivery of health care in the United States, organizations must simultaneously pursue three dimensions. First, they must improve the patient experience of care. Next, they must improve the health of populations. And lastly, reduce per capita cost of health care. Please watch this about maybe 4-minute video on how to achieve the triple aim. Next, we're going to discuss the Genesys HealthWorks model, which has been successful among patients whom have received care within the Genesys Health System. This model has reduced utilization and cost of care while simultaneously improving physicians' quality indicators. Please review the case study, Genesys HealthWorks Pursuing the Triple Aim Through a Primary Care-Based Delivery System, Integrated Self-Management Support, and Community Partnership. This case study was really enlightening and showed the combination or the association between the Genesys HealthWorks and the triple aim, and also how the triple aim can also be achieved through different delivery systems. Next, we're going to be discussing the future of our healthcare delivery systems. The future of the healthcare delivery system lies within the introduction of several innovative new models of care that may potentially realign incentives, improve overall health system performance in terms of cost, quality, and access. First, we have the Patient-Centered Medical Homes, or PCMH. PCMH is a model of primary care that places emphasis on communication and care coordination. Patient-centeredness is an important goal of PCMHs. Next, we have the health homes. They were created by the American Care Association to create a system of care that facilitates and coordinates access to primary care, acute care, behavioral care, and long-term community-based services. And then lastly, we have Accountable Care Organization, or known as ACOs. These are groups of providers that share responsibility and financial accountability for providing high-quality, coordinated care to Medicare patients. ACOs try to ensure patients receive the right care at the right time in the most efficient way. Okay, I have attached here a video link on ACOs versus patient care medical homes. Please check it out and let me know what you think. Healthcare organizations must continuously be coming up with innovative ways to improve healthcare delivery if they want to deliver high quality care while controlling cost. There are two organizations who have managed to do that well. First, there's the Intermountain Healthcare Company. It is comprised of 22 hospitals. Intermountain Healthcare provides care at affordable rates in a healing environment. Recently, they have been associated with technology partners to create a healthcare transformation lab. The lab brings innovation and technology to the patient's bedside, which is truly convenient for the patient, and it's also affordable. And then next we have the Cleveland Clinic, and they are a multi-specialty academic medical center. They focus on clinical care and research. The Cleveland Clinic is innovating care delivery by negotiating directly with self-insured employers as part of its program for advanced medical care. The PAMC program allows employers to provide their employees with access to world-class health care at a reasonable price. Again, you see people trying to make things affordable and reasonable in cost, because you can come with the most innovating technology, but if people can't afford it, then they're not going to be able to use it.